Welcome to Big Blend Radio, where we celebrate variety and how it adds spice to quality of life. Welcome, everybody. Today, we're excited to have Dr. Marschall Runge back on the show. We first met him with his book, Coded to Kill. Yes, that's right. He's a doctor and he knows about killings, right? That sounds so good. Welcome back. How are you, Dr. Runge?
I'm good, Lisa, and it's great to be back. Thank you.
You know, today is dedicated to your life and your career. I know that you've done so much in the medical world and you're keeping tabs on the medical world, not just for healthcare and patients, but actually how the health system works and AI and what can go right. And as you put in your novel Coded to Kill, what could go wrong. And it's interesting because, you start to think about when you're dealing with the healthcare system is not that easy. I'm just saying, it's harder for patients. You
Right.
get something that, maybe a major disease or issue, and now you may be scared, you get scared and, oh my gosh, my health could be towards end of life kind of thing. And then you have to deal with the medical system. I don't know which is worse. So part of your life has been to help fix that, right? And what you
Yes,
do.
and we all know, but particularly if you or someone close to you has had a serious illness, it's frightening, and it's frightening because you go from living your life to oftentimes being one of many, many people who are in a big hospital or a big health system, and the technology is frightening in itself, and sometimes, admittedly. Although we're all focused on this, we don't spend enough time helping people understand their disease and understand what the options are. And I think today, one of the great things that's happened over the last 5 or 10 years is recognition of the importance of what people want, because not everybody wants to have every possible thing tried, while other people do want to have every possible. They're going to hang on by their fingernails as long as they can. So this personal interaction between people, patients, so to speak, and their healthcare providers, I think, is really important. As you and I were talking about just briefly, I think that technology is going to have a big impact on that. And we learned some of that through the pandemic. Before the pandemic, I know our health system and many health systems, many doctors were very skeptical about telehealth and having, and maybe all of us were. We weren't doing Zoom calls like you and I are having today.
Yeah.
But it's turned out that that is a viable way. And what's most important about it is not the medium. Of course, it's nice to be seeing somebody in person, but it's that connection. And so I think much of the technology that is coming along is focused on improving that connection between people and those they see for their health. Now, as I mentioned to you earlier, before we started today, some of this can be pretty disruptive to the way healthcare is provided in the United States. For example, many health systems are building big new clinics, and maybe they won't need those big new clinics. Maybe a lot of this will be done electronically or digitally or through telehealth. But you can't, there's only so much you can do through telehealth, because oftentimes you need to examine something. Is the person's heart normal? Is their liver normal? A lot of which you just can't do via telehealth. There are some areas, so you may or may not know this, but a lot of people are who have dermatologic skin lesions or whatever, their dermatologist can get a pretty good idea if they take a photograph of it and send it to them. So anyway, we're looking at a whole new world. I think in the next 5 to 10 years, many things will change. And
I find it interesting because, when I look at patient care with my grandfather, Nancy's dad, he went through so much medically. He had pulmonary fibrosis, and he died of a heart attack eventually, but he had all these things going wrong. And it's from working in a cement factory. He got really sick and had emphysema and all of these things. They had him on like 30 to 50 drugs at a time. And so what was going on between the different doctors and what was going on at the pharmacy, no one could keep up with what was going on. And some of them were crazy. He was on prednisone, which actually made him a little bit on the crazy side. He could barely walk and breathe, but then all of a sudden he could turn around and pick up a couch and throw it across the room
I,
and be, because
I
the
shouldn't be
narcotics.
laughing,
But no, I mean, it was crazy. Like, and even my mom and her brother went to the doctors and said, they were teenagers going, this is not right. And eventually they looked at the list and they're like, whoa, because the kids started going, he's not acting normal. And then, the mom was just beside herself with everything. So the teenagers got a list of everything that was going on and went to his main doctor and said, this cannot be normal. And eventually, and then they couldn't even, when they did a heart surgery on him, they actually rocked him on a belt and did like some kind of, what's it, acupuncture to keep
uh-huh.
the pain, because they couldn't put him under because of that. And they filmed it. He
Wow.
was on TV, or for doctors,
Oh,
doctor TV, to see
right.
this was new, something new to do. But I wonder about that today, because sometimes I wonder how much do our systems look at drugs, how many drugs, and then what happens when you go to a pharmacist. Some people actually have their own personal pharmacy person that is like a consultant on your drugs. And I'm going, where are we that we, I mean, what? So do you think the systems can get better in keeping track and monitoring people's health as they see doctors, as they take prescriptions and things like that, in a almost universal, global, national way, at least?
Yes, I do. And I'm excited about it. And I think Lisa, you've hit on several issues that are, when you hear about them, they're troubling. And for the person who's involved, they're just baffling. So
Mhm.
your grandfather being taking all these medicines, and oftentimes one doctor will prescribe one thing, another doctor will prescribe another. They don't know exactly everything that your grandfather may have been on. So I think that although Coded to Kill is a fiction about things that can go wrong with electronic health records, I think there's much to be said positive about electronic health records. And actually, I'm going to briefly deviate in that direction. One of the reasons I wrote Coded to Kill, and I'm working on a follow-up novel, is to have an alternative way to help people think about challenges in healthcare. So I can stand on the podium and talk all day long, or I can write op-eds, but I think fiction reaches a totally different audience.
Mhm.
And when I talk to groups who've read Coded to Kill, primarily their questions are about different aspects related to the technology. And so one thing that we are doing at the University of Michigan, and is being done very broadly now, is developing very close ties between nurses and doctors and pharmacists and physical therapists. And so at the University of Michigan, at Michigan Medicine, we have a pharmacy team. These are people who have a degree in pharmacy um, and an advanced degree in pharmacy. And so when a patient is put on one of these complicated medications, one that has to be infused, like a IV medication,
Mhm.
our pharmacists will work with them, because as you might imagine, that raises all kinds of questions. And then they worry that, will they get their medication on time? And so we work with them. We
Okay.
also have great relationships now that weren't present 10 years ago, between pharmacists at our retail pharmacies around Ann Arbor, CVS in particular, because it's the one that has the most sites, but Walgreens and others, such that we connect through our electronic medical record. So we use an electronic medical record called Epic, which is a
Mhm.
common one. And CVS has access to our Epic. So uh, if I go over to CVS to get a prescription filled, they can look at my medications and say, well, wait a minute, did you realize that this medicine you're on might conflict with, or just be contraindicated with this new medicine you're bringing
You're
a
right.
prescription for? And so, as I said, 10 years ago, that wasn't possible. Now with
Mm.
electronic medical records, it is possible. And so I think all these connections speak to the issues you were talking about. And ideally, golly, I would hope that we can try to minimize the number of medications that we all take. I had to have surgery. Wasn't a big deal, a hip replacement. And so I was on several new medications around the time of the surgery, and I found it confusing. And so if I find it confusing, I know everybody else finds it confusing.
Yeah, and you
So
are deep in the medical world. I mean, your bio, it's like, okay, how many things, you've got a list of what you've done. I mean, doctorate in molecular biology, okay, medical degree from John Hopkins. Let's go into cardiology fellow at Massachusetts General Hospital, 250 publications you've written, 5 patents for approaches to healthcare. All right, so, that's just a little bit of it. CEO of Michigan Medicine, VP for Medical Affairs at the University of Michigan, Dean of the Medical School. Okay, so everybody get it, right? So medicine. So this is what's so interesting to me. You go into medicine, it's usually you go in out of care and understanding science and biology and those kinds of things, right? And then you see the world change. And so through your career, I mean, that's got to be pretty novel. I know what happened with my grandfather was, several years ago, decades, I should say, ago. And so it's a lot better. And it's amazing that you can go to the grocery store and pick up your prescription at the same time. I mean, I don't know if it was like that before, but in a sad way, we've lost our mom and pop pharmacies, which I think they knew what was going on with their customers. So there's a balance with this technology. And at the end of the day, don't we really want to still have that human connection between everybody? And at the same time, technology help us take care of the little trivial details that actually still mean a whole bunch. Did that make sense in that?
it makes perfect sense.
Yeah.
And it's interesting thinking back about my career. So when I started, I really was thinking about a career as a family practitioner or an internist. And as I went along, I got more and more interested in different aspects, the research, the potential for cardiology. I completed my cardiology training in the 80s. And at the time I completed my cardiology training, so I'd gone through a lot of educational years by then, but we didn't have many of the things that are considered standard. So if a person was having a heart attack, there weren't the clot dissolving drugs came along the first. None of those were approved. So there were no clot dissolving drugs. We weren't using stents to open up the arteries that were blocked. So that if somebody had a serious heart rhythm problem that might kill them, like the official name of it is ventricular tachycardia, but a lethal tachycardia. And we knew they were going to be happening. The drugs that were being touted to treat that weren't, in fact, some were harmful. So we didn't have cardiac defibrillators. We didn't have so much that we have and sort of take for granted today. I don't know if your grandfather ended up needing to be on any of those things or had a stent, but bypass surgery was present. But outside of that, most of the advanced technology used in cardiology today wasn't present. And the idea in the 80s that we would one day be able to use our knowledge of the human genome, it hadn't been sequenced. Nobody really thought that that was going to be an approach. Yet today we have a whole host of these medications that are called biological medications based on that kind of information that are so much better, so much more specific, but they either require an injection or an infusion. So it's a world of difference. And the other thing that frankly is a big challenge in healthcare today is how expensive all of this is.
Yeah.
So, an average visit to the emergency room costs $1,500 or even $2,000. A stay in an intensive care unit one night is more than that. The cost of these surgeries is high.
The medications.
Right. And
I'm fascinated by what Mark Cuban is doing. On the prescriptions. I think he's pretty brilliant, honestly.
Well, he's got a great idea. So I had to look into what is it that he's doing. So what he's doing is he's set up manufacturing for generic medications. And so there are a lot of generic medications. So the patent has run out on a very effective medication and becomes generic, meaning that anybody, well, not anybody, that it can be made. It has to be tested and made sure to be safe and effective. But he's taken not all of it. He's taken a great deal of the cost out of that to provide these medications. Now, the next step is these much more complicated medicines, the biologics. So one thing, two types that have gotten a tremendous amount of publicity recently. One are these weight loss drugs, and those weight loss drugs, if your insurance doesn't cover it, and many insurances don't, it's more than $1,000 a month. So we're talking $15,000
Wow.
a year, and that's not practical for many people. The other class of drugs that's coming along is those that will treat Alzheimer's disease.
Mm-hmm.
Alzheimer's disease, in its broadest fashion, results from accumulation of a protein called amyloid in the brain, and it gums up everything. The brain doesn't work anymore, and it starts slowly. But these new medications dissolve that amyloid, and people don't get better, but it stops their progression. So if we realize that one of our loved ones is losing their memory and they get tested, and they have Alzheimer's disease, these drugs are highly effective, but they're just coming out, and I think they're likely to be more expensive than the weight loss drugs. So, and for both classes, but particularly for Alzheimer's, somebody might be on those drugs for 10 years. So these are huge expenses that we have to figure out in America how we provide for that. Well, we know
why. I mean, it's all the middlemen in there, right? Because
lots of middlemen. And the drug companies will spend, it costs $1 billion to develop a new drug. And the trouble is that there's no sure thing that's going to work. So they spend their billion, and then they get the results of the final study, which is negative commonly. So
how hard is it on the doctor side? Because I have a friend who's a doctor too, and she's like, you would not believe what it's like to just run a small practice. She like the insurance, the cost of running, and like we talk about it, how hard it is for patients. I have a friend who went through this very rare form of cancer and had to have these transfusions once a week, over $14,000 per transfusion.
Wow.
And if you don't have it covered, or if which how many people have health insurance in this country? Not everybody, right?
Right, for sure.
And then there's the copay and all of that stuff. So she's felt lucky that she was able to handle it, but that's insane. And then if you look at on the doctor side, especially, if you're specializing in things, it's just, there's so much expense. Not that's like even talk about going to school to become a doctor. Hey, we want to bankrupt you before you even go to work.
Right.
It's like, let's do that. So it's it's a negative for both parties. Yet when we're turn on the news, politicians are using it as like a talking thing, but I don't see anything happening from it. Personally, I could be wrong, but I feel like it's become this game almost, and it's not funny. Someone's got their hands out and getting all the candy.
Yeah, good way to put it. So you're right, and I think one of the things that I find most discouraging about the political discussion is a politician has to fit this into a bumper sticker size statement, and it's very complicated. But what I'd say is, in the time that I've been in medicine, going back to the early 80s, it has become a huge business. Healthcare is approaching 20% of the GNP for the United States. I mean, that's a huge chunk of our economy. It's about healthcare. And there have been many, many advances. I talked about a few of them, but there have also been mega industries built around here, so around healthcare. So there's drug costs, pharmacies, pharmaceutical companies, providers of those. There's equipment costs. There's insurance costs, currently, the companies making absolutely the most money in healthcare are insurance companies. And many of them have bought doctor practices. One, United Health is the biggest employer of physicians in the United States, maybe in the world.
Wow.
And so
Wow.
all of those, most of those are for-profit companies. And so they have a shareholder responsibility and making a profit for their shareholders. So it's just become a big, big industry. And I think,
Crazy.
there's so much controversy about what are solutions, but I think one of the solutions is to think about the kind of government programs that we do have. We have Medicare, we have Medicaid, we have some other
Mhm.
government programs. Perhaps that's not the solution for everyone, but they are much, much more cost effective. I personally am a huge fan of a government program that supports what are called federally qualified health centers, FQHCs. And
Mhm.
these are health centers that generally serve a slice of the population that can't afford uh, expensive healthcare. And we talk in healthcare about having a family medical home, and a medical home means you have a doctor that you know, but there's a team of people that provides the healthcare, includes nurses, it includes physical therapists, it includes social workers, it includes pharmacy people. And so you have a medical home, and the FQHCs, the federally qualified health centers, they do that better than any health system that I know.
Wow.
They don't get much publicity, and it's a federal program. Without
Hmm.
they do get paid for some of what they do through traditional medical insurance or through Medicare or Medicaid, but they couldn't survive without this
Mm.
federal supplement. So people talk about, well, the federal government's spending so much money in healthcare, and that is true through Medicare and Medicaid. But it is possible. I think it's possible to think about some new models. It's taken a long time to get where we are, which has goods
Mhm.
and bads to it. And it'll undoubtedly take time to get back to where healthcare isn't such a huge expense for people. But it's a big, big part of income for many Americans. You mentioned doctors. So I don't know exactly what the number is today, but the average, I think, for someone graduating from medical school of their debt is in excess of $200,000. And so that's a lot of money, and money that they've taken out student loans for, and that it's going to impact. One of the concerns, which I think is real, is that fewer doctors are going into primary care today because primary care doesn't pay as well as very
Wow.
subspecialized healthcare, and they're worried about paying back their loans. I mean, that's a house, $200,000.
Yeah.
Maybe not a
Not in
house in Beverly
California.
Hills. Yeah, not in California, but it's a house. And
Yeah.
so it's not a vacation house. It's
No.
something you've got to pay back.
Yeah, but I think these conversations are important, and I think what's great with what you do as a writer, as a novelist, right? And then I know you also write papers, and you're doing a book with Forbes, which is going to be
Yes.
exciting. I can't wait for this because you delve into all the different changes. Um, but being as a novelist, I think you just see the sea of paperwork, whether it's on a screen. I mean, you don't even fill out papers when you go to the doctor anymore. It's all on here's my life story. I'm just going to sit there and enter everything on a little tablet, right? But it becomes this fine print that we all go, ew, like our brains, they start to shut off.
Right.
And as a novelist, I think you're going, ooh, wait, let's make this and like sizzling. It's got a mystery. There's crazy stuff going on, and you're a great writer too. That's the
Oh,
other
well,
thing
thank
is
you.
you know how to write. So I mean, it's like you know how to take the fine print. I don't know what it is. Doctors and lawyers can write, and I think it's about attention to detail. And so for the reader, we touched on this at the beginning of the conversation today, but for the reader, it kind of is a way to open up that side of the brain that wants to really close off. That's like being in school and being taught history, and you're just, here's all these numbers, and on this date this happened. You don't care unless it's a story. It's stories
You,
sell, you
you
know.
are so right.
So it's
Um, I want to let me mention to you something I think is really a great innovation. It's related to AI. So there is, it goes by the generic title of ambient AI. And
Hmm.
there are different systems, and we use one of them at the University of Michigan. Excuse me. One is we use it a lot at one of our satellite hospitals, but we're starting to use it at the university. And so this, if you and I pretend we're having a doctor-patient conversation rather than the conversation we've had, the
I would
AI.
not be so relaxed. Okay, good. Carry on though. Sorry.
So everything that we say is sucked in, and but it's not a transcript. Somehow, amazingly, in ways that I can't possibly explain, uh, our conversation would turn into a medical note, and it would
Mhm.
have what your main complaint is, and what your other medical problems are, and what your family history is, and have all of those things. And it's, just like if you play around with Chat GPT or any of the AI
Yeah.
engines, it pops out in a few 2 or 3 minutes. And so just like it sounds like you, and I think most people, when I go see, I have an internist, when I go see him for an annual checkup, he's a wonderful, wonderful person. But he is spending a good bit of his time, I'm looking off to the side if you can't see this, a good bit of his time typing in what I'm telling him into a medical record. And I look forward to the day that he and I and other physicians can just be talking. And it
Okay.
gives us a chance to think more about um, your illness while you're talking about it than to worry, did we get every detail right? So I think
That's
that's a great innovation. Uh,
yeah. That's really cool. I feel it's kind of like well, we all feel like we're being spied on, right? By Google, like even your car.
right.
I was watching a thing about you buy a new car, and because of all the Wi-Fi and Google and GPS, it knows everything. And of course, that information is being sold to advertisers. The
Right.
advertising world, our business has completely changed from when we were a print magazine pre-Google, and we were online pre-Google doing our stuff. But my gosh, has it changed? And we've had to change with it. But I always think that is the way life is. You cannot stop change. You can't. And that's the thing. We have to deal with it, and just we have to deal with it, or be a change maker yourself, right? But this, what you're talking about, I mean, we travel the country and we go in and pet sit at different places, and all of a sudden my Facebook page will have ads that maybe it's because of what the people were pet sitting for. Or you go to a bed and breakfast, and all of a sudden you'll get all these new ads because of what people have typed in or said or done. I mean, there is no real privacy anymore. Let's just be real. Whatever you said, or if you keep talking about it, even when we do Zoom calls like this, I'm going to get ads now
Hmm.
about Medicare. You know that it's going to happen. I
Oh,
can
that's
guarantee,
interesting.
or something, some kind of maybe health insurance or something like that. I
Yeah.
can guarantee you, I'll start getting those ads. So it's the same model of AI that they're using, I think, on the medical side. I also am curious is, with the advent of technology that is tracking your body, right? If this is a good or bad thing, because this can be weird. There's apps and things you can wear that's, checking your heartbeat. Does it, how's your health? How's your breathing, your weight mass, all of that? Are you doing your 10,000 steps a day? All of that stuff, right? Goes into the world of computers. And this is where I find, I mean, you're the doctor who kills people off in books. This could be interesting to me about these apps that people are using. I think they're great, but you are giving away some very personal information to be sold. And you could end up thinking, oh, I need this because, my app says, oh, you're walking 10,000 steps, but you still need to get this, this many pounds off your body. And next thing you know, you get an ad structured to get some kind of, gummy, as we all see on these ads, right? And then you go and buy it, and it's actually really bad for you, right? So, do you see what I mean? That kind of thing can go wrong. Whereas at the same time, it can really help. And I don't know if doctors are working with those apps? Like, where are we on the apps? Because I think they're good, but I think you're also getting targeted from them.
I think you're right in both ways, Lisa. So we call these wearables, and so it's a because it's wearable hooks. It's a I have an Apple Watch, so it's a wearable device that then records all these things, whether you want it recorded or not, and it goes into a massive database. Many physicians, particularly around people who treat either high blood pressure or obesity, are fans of this, and I can understand why. So with my Apple Watch, I also bought a connected scale and blood pressure cuff that for myself. And I'll admit that sometimes if I feel like I ate way too much in the last day or two, I don't step on my scale because I don't want to see the number go up. But I do keep an eye on my blood pressure and weight. Not perfect in either case, but that same information, if I wanted to, which no doctor has asked me to do this, I could make them, I don't know what they call it exactly, but make them a member of my data. So they could see that data. And so if they're watching me for my blood pressure or my weight or whatever, they'll get this information. And I think that I think this is going to get more and more common in healthcare, that these wearable devices can be used by healthcare providers. And there's some that have ways of alarming when it looks like you're going to have a problem. So, and that's getting more and more sophisticated. So there are some biological measures that can be taken by devices that might say, well, gee, you are at risk of
You're having a stroke.
diabetes. Yeah, having a stroke or a heart attack. But if you're not hypoglycemic right this minute, but you're headed that direction, and if you don't get some orange juice or something to correct your blood sugar, you could easily get in trouble. So these are all part of the milieu today, and I would say that they're part of this ambient data collection. Ambient meaning it's just collecting data. One of the things that's fascinating to me is all these devices, but the one I know the most about is the Apple Watch. They're collecting a whole bunch of other data, and the company's not going to tell you what they're collecting because they're studying it to see, can they now market their device or something else? And I think if it hasn't come out yet, the Apple Watch is pretty close to being used to monitor your blood pressure. So right now it can monitor your heart rate, it can monitor a lot of different things. And then what's next? So, and there are devices that monitor your blood sugar. There's a ring that monitors your blood sugar. So these
without actually having to do the poking.
Without having to stick yourself.
Yeah, needle. Oh, that's cool.
So that's cool. It's kind of this intersection between technology and health that is one that has its pros, one that has its cons. I want to take one little tangent and tell you about, so my follow-up book to Coded to Kill is about this wave of people, and it is amazing, that want to slow down or even reverse aging. And there have been many interesting articles in the lay press about people who, they're not even living a life anymore. Their whole life is around doing these things that they, yeah. And so, and there are several big biotech companies that have been formed, and they're being funded by some of the wealthiest people in the world to go on this quest to find genetic and other factors that could reverse aging if they were used appropriately. So that, then that creates a whole nother dynamic. Well, is it going to be that the very richest people in the world can reverse aging, but nobody else can? So, 50 years from now, we'll have people who are 130 years old, but only of a certain class.
Are they freezing themselves? Well, it is almost.
Oh, and people are freezing their bodies afterwards. You said you were in Tucson recently. I think it's in Tucson or Phoenix that there's this, I call it a liquid nitrogen freezer farm. So many famous people have their bodies frozen out there, and what they're waiting, the concept is not when they died, but maybe in 20 or 50 years, the technology will be present to cure whatever their problem was and bring them back to life. Is that weird or what? But
See,
it's
but this
not.
to me, this is starting to sound like, I know this sounds weird, but a little cultish. Because
Absolutely.
okay, well, we're having a cult show this year because did you know there's a cult awareness day and we have cult people coming on, not cult people, but people writing about cults and
Yeah.
one who has been in a cult. And I find the medical side of it about, it goes in, oh, I'm so into this because it's like the utopian societies. That's my new major rabbit hole. Like, what was an I don't know. It's almost like we're all gonna eat this and don't eat that. And it's like if you don't do this, then and it's like this, you're gonna drink this water and everybody has to meditate at this time of day. Like, I don't think, eating more of a plant-based diet is bad. I don't think meditating is bad, but it just gets into this very weird zone. And I think what you're talking about is people having a bunch of like a freezer farm. That's creepy. That is weird. But at the same time, people are taking ice baths now, jumping in a sauna, jumping into the ice. And I'm going, I just somehow I don't feel like that's naturally normal. So and down the road, I feel like it's going to, I don't know. People swear by it, but I wonder if that's really good. I also wonder about the wearables being good.
Right.
I can't wear a watch. I can barely wear sunglasses. I'm allergic to metal, any kind of
Hmm.
metal, even earrings. I've done like 14 plus karat gold. I just don't. My skin does not like it. I don't know. It's just like, no, you're not doing it. So, and plastics, yeah. Anyway, well, no, it just doesn't, but I wonder about wearing these kinds of watches and wearing all of these things. It's, they did studies about having a cell phone on your hip all the time, that it can, there's like little waves of whatever electrical currents and stuff that may not be good to have by your body. Using a cell phone constantly up to your ear can create brain cancer. So I'm wondering on the wearables, it's like someone sitting up there knowing, oh, we can make a bunch of money off these, but you know, you're gonna die off early, So sorry, you're a novelist who kills
No.
people, so you got my brain into that mode. So I find the evil ways in these things
Well,
sometimes.
you know
The
how to talk more
conspiracy
about,
theories,
we
you
want to
know.
talk more about medical fiction, but Lisa, I think you're right. And won't it be interesting in if well, you'll be around. I'm not sure I'll be around at 2040. But won't it be interesting to find out whether all these things that have been introduced, which ones turned out to be good and which ones turned out to be terrible?
Yeah.
And one comment you made there that I think is so true is um, I think there a lot of what is done in terms of innovation in the United States starts out as a good thing, but so much of what is done in the United States is profit driven. And with your new biotech company, if you're not making money, poof, it's gone. And with your devices, so I think that that is sort of the quintessential conflict of interest. Is it good? Is it going to make a profit? And
Mm.
that's what I believe that everybody, I mean myself included, is it good that I write fiction or do I need to make a profit to validate my writing?
No, you
And
better stay, doing your fiction. We want you to do your fiction, please.
so
Well, yeah, the profit thing, what's scary about this? So, and I think we touched on this the last time you were on the show, but it is the way the world is going when you're talking about this profit thing. So, we're getting to the point where we're only going to have a few people owning the internet, the actual
right,
providers, right? So there's a company called the Endurance Group, and I encourage everyone to look them up because they own pretty much all the hosting companies
really,
of
what's it
websites.
called? The endurance group?
Yep, go look them up. Start Googling that stuff. And then when you start to look at who owns Wix, who owns Bluehost, who owns HostGator, who owns all these people, so you've got to make your choice because they buy out the other companies and they become this big conglomerate, right? So basically, at the end of the day, we're all going to be running our website hosting through one big monopoly. Okay, so Google has their share, and that's a whole other, so Google and Amazon owning internet space is a very complex thing because they're getting all of our data, right? So hosting websites, you're getting people's data. So some things have recently happened that it's very fascinating to me. So in the internet world, in the website world, you have all these programs that you pay for. You hope this company is really good. So for example, we make all these online maps that are interactive. You can click on a photo and then get a link to a website. And, here's a map of the Pony Express Trail across the country, things like that. Well, the map provider something happened in his company. And all of a sudden, like you said, didn't make enough money because Google he was bastardizing Google, made it a little easier, and then Google fixed what they were doing, so people went and used Google. His company went down. And what happened to our maps? Overnight, doesn't matter how much we paid in subscription fees, one day we wake up and our maps are gone because his business went goodbye. So that's happened. And that's not, this is just one industry, but it's happening just like you said. Oh, here's a wearable. Everybody starts doing it, thinking that their information is safe, and then maybe that company closes its doors. But who do they sell that information to? China?
Right.
That's another thing. Look at the whole thing with TikTok. So the TikTok thing, that's a creepy thing because I think it's the same thing as what we're dealing with on the medical side of how much information we give out on all these little things. So yeah, look at Photoshop. They went to their subscribers and said, to keep your subscription, and we've paid thousands of dollars over the years. We've had them since, hard drives and discs and stuff, and we are going to use your content for AI testing. So in other words, what are you doing with photographers' photos and using it for AI generated content? And how do you know what's going to happen with your content? Are they going to sell it? Then they started doing it at the same time. This was just bad marketing, selling the world, hey, if you don't have to go out for the photo shoot, just use Photoshop. So they're telling photographers going out and being a photographer is not necessary because they have this bank now that they can use for AI.
Wow.
So the world's a little wonky in this department, and I think it's going to be more than the Wild West over the next 20 years.
Well, that's scary.
Yeah.
But great from a plot standpoint.
Well, I know. So now you've got a lot to write. This is. So when do you think the next fiction novel is coming out?
Well, my target is probably by the end of 25. Ooh. So a little more than a year from now. I've got it pretty much outlined. Right now, for the next 10 months, I have a full-time job that I can hardly keep up with, but at that point, I'll be doing less administrative work, and so I'll have a lot more time for writing.
Awesome. Well, we can't wait. And right now, everyone can get Coded to Kill. Amazon, Barnes & Noble, all those great places. You can get them. Bookshop.org is also great. Check them out. And then if you're going to do a book club, check out the link on the website. Contact us through that. We'll make sure we keep you connected with Dr. Runge, and book clubs. That would be fun for you to do. Like medical mystery book clubs. Come on. How cool is that?
I love doing book clubs. As I mentioned to you before we started, I've done one book club and done some other. University of Michigan has clubs and done some club events, and it's great fun for me because I get to hear what people really think, and the people there's an audience out there that's interested in talking about healthcare, technology, that interface. So I'm happy to meet with people if it's not too far away in person or via Zoom, and so let me know if you'd like to talk. I'm happy to do so.
And I hope you come on one of our Halloween shows because we could talk about frozen bodies in the desert.
Yeah, that'd be fun. Those crazy frozen body places, they disconnect the head. Now, how's that going to work? So they have the head frozen one place, the body frozen somewhere else. Just hard for me to imagine they're going to connect that all up. Yeah, there's a book that describes these farms called immortality.com. And it's, I don't remember the author's name, but it's a great book about people that, this whole view of becoming immortal that is pervasive through the United States anyway, if not internationally.
Oh, wow. Okay. So we got to do that. And then the cult show. All right. We've got a lot to do.
It sounds like it.
Thanks so much. It's good to have you back on the show, Dr. Runge.
Thanks, Lisa. Great to see you.
Thank you for listening to Big Blend Radio. Keep up with our shows at bigblendradio.com.